I've told patients for the last 25 years that dry eye is simply, it's a part of getting older. We're all going to have dry eye as we get older. But we're learning that that's not necessarily true. And I'd like to use the analogy of dentistry. So 60, 70 years ago, most people over 50 had lost their teeth. And I'm sure doctors back then told patients, you know, losing your teeth, that's just part of getting older. Well, we know better now. If we don't brush and we don't floss and we don't go to the dental hygienist, what's going to happen is that biofilm is going to destroy our gums with gingivitis. We're going to lose bone and we will lose our teeth. And when the teeth are gone, they're gone forever. Well, the same process we are learning occurs on our eyelids and the base of our lashes and the lid margins. And this is referred to as blepharitis.
Well, blepharitis literally means inflammation of the eyelids. Bleph means eyelid, itis means inflammation. So it's really a low-grade chronic inflammation of the eyelid margin. Especially affects follicles of the eyelashes and the pores of the oil glands that live in our eyelids. We do typically see an increase in blepharitis over time as patients age. However, we can see pretty severe cases in individuals that are maybe in their teens or 20s, and it's most likely attributable to a lot of screen time that can lead to some tear stasis or stagnation of the tears, and that mixes with bacteria and kind of leads to a lot of that inflammation at an earlier age, unfortunately.
It could also be the things that we're doing to our eyelid margins. Fake eyelashes, we're learning, are not the healthiest thing for our eyelid margins. You know, permanent tattooing and different types of mascara may not be the healthiest thing for our eyelid margins. What we're seeing with new infrared photography that we have, and we're using it routinely now, is that the glands inside of our eyelids, these are called meibomian glands, and they are critical to the health of the surface of our eye. So the meibomian glands that line our eyelids produce a fatty material that is supposed to flow like olive oil. But what happens is, through inflammation from biofilm, the fatty material solidifies like toothpaste. So instead of flowing, it doesn't. And then the biofilm actually backs up those glands, and it can destroy the glands. And when the glands are gone, they're gone. We cannot bring them back.
What we're looking for is normal architecture or normal anatomy, but in so many patients, well over half, you're going to see that those glands are either missing, or they're shrinking, or they're disorganized in structure. Those are all signs of the fact that they have chronic blepharitis and meibomian gland dysfunction, and we really need to work to preserve those glands.
So I'll go back to the dentistry analogy. So we have flossing for the eyelids, and it involves a warm compress called a Bruder mask. If you heat your eyelids, the glands are flowing better. And we have toothbrushing for the eyelids, and these are a series of wipes that patients can use in the evening before they go to bed. And it's just like brushing our teeth. It's keeping the biofilm from reaccumulating. We have dental hygienist for the eyelids, and it's a procedure called BlephEx. So BlephEx is a special solution and a special tool, and it removes the biofilm from our lids and our lashes, and it opens up those glands, the meibomian glands, and allows them to flow, and it keeps them healthy and from backing up and literally dying.
And it's a quick and easy in-office procedure that acts as a deep cleaning. And it is basically consists of a rotary Dremel tool, so it's spinning at a very high rate to do a deep cleaning. There's a sponge on the tip. It's not painful at all. It actually, patients say it tickles a little bit, but it wipes away biofilm, unclogs pores, and decreases inflammation through that mechanism of action. So after the BlephEx treatment, the results or sensations of the result can vary. Some people have very inflamed lids, so they could be a little red, slightly irritated, but a lot of patients say that they can literally feel more oil in their tear film right away. And in fact, when we do it, after we do it, we express the glands and we directly visualize more oils coming out of those glands. So we know the patient's more lubricated, but their symptoms might trail off over of dryness. They'll feel less and less dry, maybe trail off over the course of a month and start to improve as those oils are there on a daily basis in an increased amount. And they're doing their at-home lid care as well. So in combination with the at-home care, BlephEx is highly effective at reducing symptoms and the signs of dry eye and chronic dry eye syndrome that is associated with blepharitis and meibomian gland dysfunction.